Gastritis is the inflammation of the gastric stomach mucosa. It can be acute gastritis, sudden, short-term, or chronic gastritis, which is a persistent, associated with long-term conditions like H. pylori infection or autoimmune disease. Common causes of gastritis include infections, Helicobacter pylori, most common cause of chronic gastritis. Drugs, NSAIDs, aspirin, ibuprofen, corticosteroids. Alcohol and smoking. Stress, severe burns, trauma, surgery called stress gastritis. Autoimmune disease, autoimmune destruction of parietal cells, pernicious anemia. Bile reflux from duodenum. Pathophysiology of gastritis. Stomach lining normally protected by mucus plus bicarbonate plus blood flow. When these defenses are impaired, gives acid and pepsin, injure the mucosa, gives inflammation and sometimes ulceration. Clinical features or symptoms include epigastric pain or burning upper abdomen, nausea, vomiting, loss of appetite, bloating, belching, in severe cases, hematemesis, vomiting blood, melena, black stools. Diagnosis, clinical history plus symptoms, endoscopy, direct visualization, biopsy for H. pylori, urease breath test or stool antigen test for H. pylori, blood tests, anemia, vitamin B12. Treatment depends on the cause. Remove irritants, stop NSAIDs or non-steroid anti-inflammatory drugs. Alcohol, smoking, H. pylori infection, triple therapy to antibiotics plus acid suppression, proton pump inhibitors, omeprazole, H2 blockers. Autoimmune gastritis, vitamin B12 injections. Supportive, avoid spicy foods. Stress management.